health is wealth, right? Today, people, we have this amazing edition of you for you, which is the Bring It On TV show on CMTV. We know you're used to the 5 p.m., 5 to 6 p.m. slot, but today we have this amazing edition just for you. It's special, that's why you have it at this hour. And this is the Bring It On TV show, and I am your guest, Tabi Anne. This is the Bring It On TV show where we have amazing topics for you. We discuss wonderful topics for you, topics that would enlighten you and that will push us, not just you, but I as well, and our guests and our viewers, towards bringing change into our lives and to our communities. So people, right after, we'll be getting into our topic proper. So see you right after this jingle. Welcome back, televiewers. This is the Bring It On TV show, your favorite live TV show on CMTV, your favorite TV channel where entertainment is never enough. Yes, CMTV. And this is the Bring It On TV show. Like I said, we have a special edition for you, just for you today. It's Saturday, right? The day is not yet over, so why are you in a haste? We have this amazing edition for you. And our question for today is really amazing. Our topic is centered on health. Like I said at the beginning of our show, health is wealth. And our topic runs forth, or our question runs forth. Can excessive sexual intercourse lead to prostate cancer? Can excessive sexual intercourse lead to prostate cancer? What do you think about this? Our question is right on the screen. You tell us why you think and what your reason, and if you tell us no, give us a reason as well. Don't forget to tell us where you're writing from and who you are, because we always celebrate our viewers, right? We always celebrate our contributors, and we celebrate everyone who belongs to the Bringers Nation. Yes, we are the Bringers Nation, and this is that hour of change. It is that hour of enlightenment. It is that hour of impact. And our question is, can excessive sexual intercourse lead to prostate cancer? I don't know. So please send in your contribution. We are waiting. And our contact is on the screen, which is 678028885. 678028885. Tell us what you think about this topic. And like it's always said, we always have someone on the stage, right? Someone on set with us, or someone in the studio with us, who always gives us exactly what we need. And even more, something like that. So we actually have it, and it carries us not just for that day, but right through our moments. And like I said, health is wealth. You cannot go out to carry out any activity, or you can't even go to work if your health is not perfect. Like for our men who are hustlers. Come on, I know you love hustling. Get up in the morning, pap, you're gone. And if you get up in the morning and you're not feeling too well, how do you expect that you have a good day? Or how do you think you become productive, or you get that money that you said you want to get? Like I said, your health is wealth. And today we have a wonderful guest with us. I know you've been waiting for this part. We have a wonderful guest with us today, and her name is Dr. MathaMical. And she is a medical doctor and an advisor with KOCAN Africa. Yes, you heard me right, KOCAN Africa. I know most of you are surprised. You're like, KOCAN? Yes, you've had KOCAN. Yeah, we've had someone from KOCAN before. And they did tell us a whole lot on liver cancer. Today, they have something fresh for us. It's not liver cancer this time around, because they've give enough on liver cancer. So today, they'll be telling us something special. And I'm not going to be letting the cat out of the bag, because I'm giving her the floor to do that herself. So we'll be going straight to our guest this moment. Ma'am, you're welcome to the show.
Thank you, and
it's a privilege having you.
yeah, thank you.
And I believe our viewers, please don't look too much. I believe most of you want to know, or I also, our viewers and I want to know who you really are and then what you do.
Thank you, Anna, for this. I'm Dr. MathaMical, a medical doctor, general practitioner, and also an advisor for KOCAN Africa, Kick Out Cancer Africa, which is an NGO which is based in Cameroon and works to eradicate cancer in Africa, especially Cameroon.
Okay, that's really amazing. So people, we've actually had a new introduction or a whole new mindset now on what KOCAN Africa is all about. Now we're getting into our topic. I know most of you are like, what's prostate cancer? What's prostate? I myself only want to know. For instance, I'm getting back to our doctor because she's here and she's going to be giving us exactly what we need. And don't forget to send in your questions because that also will help us or will help you understand and build up your mindset. You might just have a wrong mindset about certain things around you. So send in your questions. It's right now. So Dr. Michael, we actually have this question for you. You said prostate cancer. We're coming on set today to talk about prostate cancer. Like our question says, can excessive sexual intercourse lead to prostate cancer? Now, what is prostate?
Okay, well, the prostate is an organ.
Okay.
Just like the liver that you discussed about the last time, the prostate is an organ. This organ is only found in males.
Okay.
In men, in only men. Then it is found in the pelvic. Like you have your belly down after the belly. It's just inside it. It's an organ which is located under the bladder. The bladder that contains urine.
Yeah.
Yes. The prostate is under it, and it is the canal through which the urethra passes. It comes from the bladder and goes out to the penis. So the prostate is just the link between the urinary system and the penis. Like,
okay.
Yes, it's an organ.
So it's it's between the urinary system
and the genital tract.
Okay, the genital genital tract.
It is just under the bladder, and after the bladder, it is in front of the limit of the pelvis. Actually,
okay. All
yes,
right.
It's an organ that is a gland. It's
all
a gland
right.
organ.
So last time we actually spoke on liver cancer.
Yes.
And they gave, we had a representative from your organization, that was Mr. Etube Ezikiel. He spoke a lot on liver cancer. Now you're talking on prostate cancer. Now, this particular, when you call it prostate, you've already told us what prostate is all about. It means this cancer affects just the prostate organ?
Actually, yes. The prostate cancer, it's a cancer that affects the prostate, just as the liver cancer affects only the liver, breast cancer affects the breast. Prostate cancer, it's a cancer that affects the prostate as a gland. This prostate now has the glands of the glands that of the prostate. The cells now multiply differently. There's an anarchic multiplications of cells in that organ, and it leads to cancer. It's abnormal, it's anarchic, and it's just
it's all way out of
yes, out of the normal way tract.
Oh wow, well, that's really amazing. So viewers, you're paying attention, right? It's just starting. I know most of you are like, I'm still trying to find. Of course, you're finding your way around it. It's not something complicated, at least at the moment, because at the moment I know what a prostate is, and I know what prostate cancer is and how what it affects. Now we'll be getting into another part with our guest. So we actually you've spoken on prostate cancer. And now, I know most people are like, if you have malaria, they're like, oh, you've been bitten by this particular type of malaria, this particular type of mosquito, and then that's why you have the malaria. This is a cause of malaria, or maybe you might have a running stomach, and you're like, oh, those are causes of a running stomach. Now, what are the causes of a prostate cancer?
Actually, cancer is a disease which does not actually have a real cause, but you have risk factors.
Okay.
Prostate cancer as well does not have a cause per se, but has risk factors, among which you have, of course, being of the male gender. Being a male already predisposes you to have prostate cancer. More than that, if you are aged more than 50 years, you have a greater risk to develop prostate cancer of 2 times than black race. People of black origin, people of even black Americans, they have greater risk to develop prostate cancer, just as and this is why demographically, people who live in America also have greater risk to develop prostate cancer as they are of black American, black origins.
Yeah.
Yes. Also, other risk factors that we could have are tobacco smoking, cigarette smoking. You have alcohol consumption. Also, there are some chemicals found in the products we use to make our crops grow, they also have been found to be risk to prostate cancers.
Okay.
Other risk factors are disease affecting the prostate, like prostatitis, even sometimes benign prostate hyperplasia, when the prostate enlarges because of one reason or another. Other sexually transmitted diseases such as gonorrhea or chlamydia also are risk factors of prostate cancer, just because they can lead to prostatitis, which is an inflammation of the prostate. Also, we have risk factors that are linked to the family. If one of your family members had prostate cancer, you are at risk to develop prostate cancer.
Okay.
In this group of risk factors, you have the family aside and the genetic aside. It's true that genetic, it's linked with family, but you can have a gene in you that predisposes you to have prostate cancers. Such genes such as HCA1, I will not go into details, but yes. So some genes, just as the same gene that is in ovarian cancer, you can have them in prostate cancer, in some types of prostate cancer. That's why not only the fact that you had a parent who had prostate cancer can give you a risk to develop prostate cancer, but also if one of your family members had or ovarian cancer, colon cancer, even sometimes breast cancer can lead to can give you higher risk to develop prostate cancer.
It's kind of hereditary.
It is kind of hereditary, yes, because you have family history, then genetic history. Those are different because it's not always the same.
All right, so family history can come with the father has it, the child, immediate child has it, and genetic can be as the child has it, and instead his great-grandchild has it.
Yes, actually. Oh, wow. Because with family history, for example, you have 2 times more risk of developing prostate cancer if your direct parent had prostate cancer. Your risk decreases with maybe it's second-degree parent, maybe it's your grandparents, not your parent directly, it's your grandparent who had prostate cancer. You still have that risk, but at this moment is lower. The risk is lower than in the first case.
Okay.
With genetic predisposition, actually, your parent could have had prostate cancer, but if the gene is not the same as what you have in you, you will not have prostate cancer.
Oh, wow.
You understand what I mean?
Yes.
Also, it's not merely one of your direct parents, maybe your grandfather or your aunt, can even be an aunt of yours. It is also differentiated from family history, because even if it's not prostate cancer, you can develop prostate cancer after one of your parents had ovarian cancer or colon cancer.
Oh, really?
Is only actually it's only linked to genetic malformations, at birth.
So like you're saying, there's a possibility of you developing prostate cancer even if you have someone who actually had not had prostate cancer but must have had liver cancer.
Mostly colon cancer and ovarian cancer. Those are the two.
Okay, colon cancer and
ovarian
cancer.
Yes,
okay.
Those are the two. Which studies have shown that the presence of a gene in those patients was similar with one found in patients with prostate cancer. Yes, and when we had to do investigations, those patients were having family history of ovarian or colon cancer. Actually,
wow, that's really, really amazing. Viewers, I believe you guys are picking this up. I believe you can pick it, because I'm really getting a lot out of this, especially the area of the hereditariness, because we understand the myths. We live in Africa, come on, and we have this myth which says that because this parent had this, there's a possibility that you will have it. Now she's made something clear today, which says it's not, you might not have it. The same as you might not develop the same type of cancer, and she has given us the difference and the 2 possible kinds of cancers that can lead you to getting that particular type of disease in the future. And now we'll get into the question, which says, you made mention of men in the course of talking about prostate cancer. Is it only men who have prostate cancer?
Actually, yes. It is just like women can have cervical cancer because they have a cervix.
Okay.
Only men can have prostate cancer because they have prostate. Women do not have prostate, so they cannot develop prostate cancer.
Okay.
Among the risk factors, actually, I forgot one thing that is really important. In our setting where usually we eat more vegetables, we eat maybe fukan and vegetable, we eat arrow. Actually, it's a good habit because a poor hygiene concerning food leads to higher risk of developing cancers because foods rich with meat, high protein, plus fried meals,
fries and all the like.
All these industrialized meals give high risk to develop prostate cancer.
Okay.
Instead, food that are more made of vegetables give less risk to develop prostate cancer actually.
Okay. Wow.
So obesity also, because of when you have an industrialized way of eating, you put on weight, then you have obesity. Obesity actually is a great risk factor for prostate cancer, just because in those patients there are some, I will not go into details again, but I'll just make it clear, like there are chemicals produced by those patients, those people who are obese, that have an impact to the normal functioning of the prostate, leading to prostate cancer. Actually.
Okay. Wow, that's really amazing. And you've made mention of that. I believe it's clear. You, as a woman, you have no risk of developing prostate cancer because why? You don't have a prostate. What you have is a cervix. You have a prostate. And for the men, you actually don't get cervical cancer. What you have is a prostate cancer. And now we actually have this. How can it be, you know, what are the risks of developing prostate cancer? You made mention of, especially when people are in their the old ages. It doesn't mean that someone of, or let me say a child of as young as, let's say 14, 15 develop prostate cancer?
Actually, no.
Okay.
It's not, the prostate cancer occurs in elder patients because at this moment, the prostate functioning is not the same. There are, the cells are, the glands of the prostate are not functioning well.
Okay.
And with time, there's an abnormal multiplications of cells that lead to prostate cancer. Okay. So usually, we can have precocious prostate cancer, but those patients are usually like 40, 30 years, but we have never seen a case before that.
Okay, before 40
before
and 30.
40 and 30.
Oh, wow. I believe that comes as a relief to most of our viewers. That comes as a relief to most of our viewers, but we're not trying to scare the older population or the adolescent population. We're just trying to get it, you know, sensitize and educate our people, our population, on the things that actually exist outside here and the risks that we all stand or we are exposed to and how we can best avoid them. That's why we are here today. So don't get scared. Just receive it and be cheerful. And now we actually have this. You've spoken about that. Now, in respect to, we have people in areas where they'll be like, oh, we know when we go, we have for instance, let me use pigeon, like how for a very common situation. We have this mama or this papa who be like, say when we get sick, so if we just go buy them for some doctor for corner here, we go buy them for this small and I'm also my next day for years, so they never just give me that medicine, I go just drink them. So do they have permission to go to the most simplest clinics around, or must they go to a bigger hospital to get checked up for this?
Actually, our population faces some difficulties to go to clinics, hospitals, and other health facilities that provide the good services. Yeah. But prostate cancer, just as any other cancer, needs to be taken care by a professional. Okay. The babaju at the corner of the kitchen, yes, will not actually help you. Maybe he will give you some nice words so that you can feel comfortable with your disease, but no. When you start having symptoms like difficulty in urination, painful urination, blood in the urine, those three particularly, you must go to a general practitioner, a doctor, who now can lead you to refer you to an oncology clinic, to an oncologist.
Okay.
Yes.
I'll actually come into the part of the symptoms.
Yeah.
Because you just, thank God you just mentioned it. At least it saves me some, energy. But all the same, that you made mention of difficulties in urinating. And you made mention of, for instance, let's just take of the difficulties in urinating. Does it mean that with every little difficulty you have in urinating, you might possibly just have prostate cancer?
Let me first of all explain what I mean by difficulty in urination. Difficulty in urination in the sense that you push hard before urine comes out.
Okay.
Difficulty in urination, like you feel that you have the envy to urinate, you go to the toilet, but nothing comes out. Like you just feel the urge to urinate, but there's nothing.
Yeah.
Difficulty in urination in the sense that you have the urge to urinate at every time. Even when you are just from peeing, you still feel that urge to urinate. Those are different kind of difficulty in urination.
Okay.
And any male at the age of 50 that feels such symptom should consult a medical doctor as soon as possible. And
not go to that baba beside or that doctor that they always call. Don't go to that doctor beside or that nurse titi. They always call, like, we always watch TV, right? We have nurse titi. Don't go to nurse titi or don't go to nurse Desmond. Go to a medical doctor, like she has said, and get yourself checked. Get consultation, proper consultation, so you know what's really wrong with you. And now you made mention of urination. So apart from urination, what else?
Okay. After difficulty in urination, as I said, there is blood in urination.
Okay.
There's blood in urine, I mean. When you go to the toilet, urinate, maybe as you start urinating, there's blood first of all coming out. Then urine, you are urinating, there's blood coming out when you're already urinating, or at the end of the urination, you see blood coming out. Those are symptoms that you should, that raise an alarm in your head. Yes. There's also painful urination. Like you go to the toilet, you urinate, then you feel pain either in the pelvis, yes, or you feel the pain at the tip of the penis.
Okay.
Yes, actually, those are signs that raise an alarm to you. There's also you feel uncomfortable. There's also the pressure you feel when you want to urinate, but there's a pressure that you feel that make the urine just comes out without you noticing. Incontinence. When you also have incontinence, those are signs that raise an alarm to you. Apart from signs of urination, general signs include weight loss, asthenia, I mean, when you feel tired every time, yes, you lose appetite, anorexia, and then you can feel a mass actually. You can feel heaviness. Heaviness in the pelvis. Yes, those are also general signs that you can have that raise an alarm.
Okay.
Those signs usually come at the early stage of the disease, but other patients may experience low back pain, or those they would think that maybe it's arthritis. They are feeling pain on the like,
especially for people who like consulting themselves.
Voila.
Like you're just like, I have malaria.
Actually,
seriously.
So you feel the low back pain, and you also have those urinary symptoms. Just know that maybe something is wrong. I should consult a doctor urgently.
Yeah. All right. We actually have this. I know most of you are really eager and agile. Calm down, calm down. She's not running away. She's still here with us. We still have time, and I still have a lot of questions. And I know you still have questions. But keep on sending in your contributions because we are receiving them already. And our question is on the screen, which says, can excessive sexual intercourse lead to prostate cancer? Can excessive sexual intercourse lead to prostate cancer? What do you think about this? Are activities influenced and they always bring results. So can this particular activity in a man's life lead to prostate cancer? What do you think about this? Our question is on the screen. 67802-8885 is our line, and the lines are open. Send in your contribution and we'll be reading it on set for you right away. And don't forget to tell us where you're writing from and your name. So right after this break, we'll be getting into our contributions, getting contributions. So for those of you who are still delaying, I don't know what's keeping you, but keep on sending in your contributions. So see you right after this break.